Preparing. Okay, hello everybody. Thank you for joining us. And just that we had a lot of struggle today to come up with this program because we were facing a lot of problems with power here in Chennai. It's raining, and I have my guest, and we are just coming live here with my guest on episode of Eclectica, and we'll talk about a very, very interesting stuff today. So before I begin, let me just introduce my guest. As you can see, she's very gorgeous. So I have Dr. Swarna Prabha Ashok. So Dr. Swarna Prabha is a laser and aesthetic dentist practicing in Tamil Nadu for the past 9 years, completing her graduation in 2013 from Ragas Dental College and Hospital, Chennai. She joined a private practice in Chennai to learn more about the clinical side of dentistry. She is always keen to upgrade her knowledge and practice, and hence she underwent training in orthodontics, laser dentistry, and implantology with a vision to provide all treatments under one roof. So you can understand she is a very well-trained clinical professional in the field of dentistry. Here it doesn't end. She also completed her diplomate in orthodontics from IDRR and Orthodontic World Institute, Spain, associate fellowship in laser dentistry from World Clinical Laser Institute and Indian Academy of Laser and Dentistry, and she also did fellowship in laser dentistry from Savitha Dental College, Chennai, and training in implantology from SM Dental Study Group. Well, with an aim to make dentistry accessible to all, she started her rural laser dental practice, through which she provides quality dental treatments. She's also passionate in imparting her knowledge to the fraternity. She's also a scientific writer and a strong advocate of evidence-based dental practice. She intends to combat the myths pertaining to dental treatment amongst the general public and the general notion that dentistry is not lucrative anymore among the dental fraternity. So she also loves reading, writing, and composting, and is fond of fur babies. That's so sweet. Thank you, Dr. Swarna Prabha, for hanging out and sticking out today. I think we had a really tough time. But anyways, it's good that we are live, and I welcome and I thank you for accepting my invitation.
It's an honor to be here on your show today. And amidst all these glitches and difficulties, and I'm finally happy to start the conversation with you.
Right. So, Doctor, I would just like to ask few questions, and because that's my job on this Eclectica, and I think your insights will inspire a lot of young people and early career dentists, and as well as mid-career dentists who are not very aware of lasers, or maybe they are aspiring for lasers. Well, so before we go into the core of the conversation, I would like to ask you that as a avid clinical practitioner, how do you think dentistry has evolved over all these years?
Well, to be frank, dentistry has come a long way from where it was about in 17th century, something like that. Initially, dentists used to do only extractions as a remedy for dental aches. Now, we have come a long way wherein we do single-visit endodontics, digital CAD/CAM dentistry, and immediate implant loading and all that. So I should say we are heading towards an era where we are doing a dentistry which is more comfortable, less painful for the patient, and also less cumbersome for the dentist also. So we have come really a long way.
So that's really nice, and I agree with you completely. And the type of innovation advancements, particularly in the biomaterial side, dental biomaterial, I think that has tremendous growth. It has skyrocketed. That R&D has developed so much that today we have so sophisticated and so advanced types of dental materials that we can actually we can sculpt out a whole tooth, even if it is whatever how disshaped it would be, but we can actually carve out the whole tooth like original one. So in this context, I would really like to know from you that why did you choose laser dentistry in particular? What was your mindset or thought when you actually, wanted to get into laser dentistry as such?
Okay, what fascinated me about lasers was that the first time I witnessed laser dental procedure was my consultant, Dr. Pramila ma'am. She was doing a freenectomy for a 12-year-old patient.
Okay.
And what fascinated me was that just by manipulating the light laser parameters, we can get the desired result on the tissues. So the light can bring about desired changes at the cellular level, and which makes the treatment more predictable with favorable outcomes. So this was what fascinated me first. I felt this was a smart work. Instead of doing a rigorous work and waiting for the healing to happen and inflammation to settle down, I felt this is smart work. So that is what made me to explore more and learn more about laser dentistry. And with that, I did my associate fellowship, and then later went on to do my fellowship in laser dentistry. And I should say this still keeps fascinating me.
Correct. So very well said, actually, as you said that I think lasers in dentistry is a boon. And I think that way, if we see lasers as a technology has been well adapted quite long before, like long ago in the other medical, healthcare or other medical divisions. But I think in today's time, laser dentistry has come up quite well. And I think you say the right thing, and I think it's more comfortable for the patient, as well as it is less toiling for the dentist as well. So since you are doing a rural practice, coming from that understanding, I would put forward my next question to you in something like this way, that what do you think is the perception of patients towards this laser technology? Or if I just tweak the question, I can just ask you that, are really the patients aware of this kind of technological advancement being offered to them, particularly in oral healthcare space?
Yes. So this is actually quite a new space. So wherein I educate the patients when I'm about to do a laser treatment or something like that, I tell them what is the advantage that they can get with this technology, and what are all the disadvantages as well. And with any new technology, there's a two reaction. There's a love-hate relationship. So initially, people do have some fear regarding whether this might hurt me or harm me, or whether this is something that might emit any radiations or something like that. But with understanding of all these equipments and all that, we can alleviate their fears. So, and with regards to lasers, they belong to the non-ionizing spectrum of electromagnetic radiation. So they are harmless. They don't tend to ionize or cause any changes in the body, harmful changes in the body, as what generally X-rays or gamma rays do to our body. Correct. So in that way, it's very safe to use for anyone, except for some contraindications. Correct. So in that way, by educating them, I'm able to deliver the technology at its best to them. And sometimes what happens is, when they come for the subsequent treatments, they tend to ask me, why don't you do this with a laser treatment? I have had a patient who came with acute pain due to pericoronitis, and I did the operculectomy with lasers. Okay. And they came after a few years with pain on the other side, due to the wisdom tooth. And she asked me, why don't you do the same on this side as well? But it was impacted, and it had to go for a surgical extraction. So that is what, when patients, they get educated and they realize what lasers can do for them, or what any technology can do for them, they tend to ask for it. So correct. In that way, by educating the patients more about the technology and what it can do for them, they tend to get more aware.
Right, right. I think that was wonderfully explained, and I agree with you that awareness in the field of science and technology is very much necessary, and that is where the success as a clinician, like whatever treatment plan we are planning for the people, or the kind of prognosis we are looking forward. I think that makes sense when we have the cooperation and acceptance from the people themselves, and as you say that when they're aware, they themselves ask. I think that works, and that is where we should be heading, and we should try to motivate, and rather I should say educate. That's the right word which you use, that I think we need to educate people about all these advancements in dentistry, and how this can help them in maintaining their oral hygiene, or even treating many diseases of the oral cavity. Well, so doctor, I was just wondering that I understand that you are working in a rural setup. I'm not setup, rather it's not an urban city, like everybody wants to be in a city, like all these metro cities and all. So first of all, that in this kind of a environment, uh, how well were you able to offer this technology to the patient? And like coming to the commercials, definitely as a clinician, I'm sure that you have offered a lot of benefit to the patients, but was it mutually beneficial, like for the patient as well as for you? Because you are there is a cost behind when you incorporate any new technology. So there'll be a lot of maintenance costs, maybe accessories and stuff. So how did you manage, and were you able to offer this kind of advanced technology there? I really want to know that, because this is something which will break the so-called existing myths that you cannot do certain things in other than urban cities. Yeah.
Exactly. So even I had this fear initially when I was about to invest in lasers and all that. But being very fascinated about the lasers and what leverages it can offer, I made a decision and I went into the laser dentistry. And I thought, why should I not offer them to the population, rural state also? Why don't they this accessibility to laser treatment? So as I said initially, there was a fear regarding all this. But eventually, when I included not just exclusive procedures with lasers, I also do laser assisted procedures, as in disinfection of root canals, or when doing a curettage with lasers, or a gingivoplasty, or a disinfection of a cavity, something like that. So they tend to witness these treatments and understand the advantages that they get. So what happens is, when you charge them accordingly, they are ready to pay. But cannot be so high as in what urban population pay. But then this is like an indirect return on investment. Like, for example, when you purchase an instrument and you do a procedure, it is like a direct return on investment on what you put on it and what you get on it. Whereas with lasers, they will do an indirect marketing to your practice. In that way, it is actually a bigger picture that we see. So in that way, I would definitely say this has brought in a benefit both to me as well as to my patients. So I have no regrets that I've invested in lasers today. So even if anyone has doubts as to how can I use that, how can I take the return on investment on lasers, I would definitely say go ahead, but you need to plan your treatments accordingly. You need to include them. Sometimes what happens is some doctors, they purchase the units and keep it in their clinics. They do not know where to use it.
Yes.
So only if you keep using it regularly, you'll witness the advantages they offer and how they change your practice. It will be a wow factor, simply put.
Exactly, exactly. I mean, that I think you have just cracked all the very important aspects, because I think, as you said rightly, that when we need to offer something, as well as you said that people, many clinicians would buy it because they need to buy it. They might have heard, or they see their fellow colleagues doing the same thing, but they don't know actually exactly how to use. There are a lot of dental practitioners who doesn't know how to use a laser till date, in spite of being that this field of dentistry has really come up in the last couple of years, what I see. So in this context, I think it is also necessary to educate the fraternity. So I think, and I know that you are very interested in providing or sharing your knowledge, rather I should say giving away your experience for the benefit of your fellow colleagues in the dental fraternity. So my another question would be that, is there a way where dentists can learn more from you about laser dentistry, or say, I mean, how do you think that you can contribute to the dental fraternity through, or by sharing your experience and knowledge? Any plan you have in this regard?
Yes, absolutely. I have a plan. I have a couple of sessions coming up in the form of online laser dentistry courses.
Great.
The the first of which I'm planning it as a free session, and the subsequent sessions will be a paid session, but that does not be pinching your fan, as in.
Yeah.
So I'll be posting the updates regarding these online laser dentistry courses
Mm-hmm.
and on my social media handle. So if you do follow me, you can get the updates, or you can also inbox me regarding the same. And
Correct.
if at all you do want any sessions or any particular topic, or you have any doubts regarding these, you can definitely contact me. Not an issue. And yes, so I'll keep posting the updates about these online laser dentistry sessions that I'm planning. And the first one, I'm planning it in December 2022. That will be like a AMA session. Ask me anything about lasers.
Great.
So I'll post the YouTube link again for this, and
Mm-hmm.
you can definitely watch it. And later you can make a decision as what you want to do in laser dentistry.
Right, right. That is amazing to know. Well, in another context, in a little different context, like we are talking about the benefits to the patients, the benefit to the clinicians with lasers. So, how you think that lasers can impact your treatment rendering? So that was a vital thing which I was just running in my mind when you were telling about your mentorship stuff. So, can you just give me some insights on this aspect as well?
Yes. So initially, when I said how dentistry has come a long way,
Right.
so today we dentists actually face a lot of occupational hazards. So
Correct.
I think going with the technological advancements and all that, we need to do a lot of smart work. And laser is one such technology which will enable us to do smart work, wherein you can do and achieve a lot within a short span of time. You need not make the patient come back again for repeated follow-ups, and so it will make a more predictable treatment outcome, wherein
Mm,
you're free of any worries or stresses as to how the patient tissues might respond, what might the patient say regarding the outcome of the treatment, or when will the patient call you and say, hey, doctor, I have a problem regarding this treatment. So you will experience a stress-free dentistry when you go along with the technological advancements. That is what I feel, and that is what I have experienced so far with including lasers.
that's wonderful. I think you are going to complete almost a decade, nearing a decade of your practice. So I think you have a lot of experience, and I'm very happy that you have planned to come up in an online mode, because I think for educating the dental fraternity, for that matter, like aspiring dentist or early career dentist. So in this context, definitely I would like your insight in one aspect that we are doing and from our grassroots level, how much we can do is that about our koshish, that is the effort we are trying to help people come into this online domain and share their experience, and this kind be and build a side hustle for them. So it would be very kind of you that if you can just mention your experience through the program or through the mentorship program that you are going under the banner of Koshish, that is Croyna's online course creation income system. And I think that would really inspire many minds, and we will very soon form a very strong community, and we can help people to at least build some side hustles, some parallel incomes, just by exploring or sharing their experience, just like as you have planned. And I really appreciate your efforts and your enthusiasm in this. So I'd really like your insights, and you please tell to my audience about this.
Yes, so this Koshish is like a online course creation system wherein you can learn what you want in an online mode. And if you're interested in mentoring or sharing your knowledge, you can also become a mentor through this platform. And you might have a doubt as to what can we learn about dentistry through online mode. But for people who have a barrier regarding how can we learn from international educators, or how can we even within a boundary, how can we go and attend something that is happening in other part of the India, or how can I attend this? I cannot invest so much on a conference or a course. This might be a good platform to learn and to impart education as well. So I think this can also be looked upon as a side hustle for those of you who are looking to share your knowledge with others. So, and this is available on LinkedIn, and the website is also available, which will be shared in the description. So do check out this Koshish, KKOCCIS. And even I'm starting my mentorship journey through this. So, and I'll share the updates as well on all my social media handles.
So, doctor, as you said that if somebody wants to contact you for your mentorship, or like if they have any doubts, if they want to contact you directly, and when you are bringing up your course, so can you just tell us that what are the social media handles you are most active, so that people can literally go and share their ideas or share their queries and just get in touch with you? So it would be very nice if you tell us about what all on the platforms you are most active.
So I'm available and most active in Facebook, Instagram, LinkedIn, and WhatsApp. So you can contact me through any of these handles. So, right. And all my handles are available in my name only, Swarna Prabha Ashok. So don't worry, it's easy to find out.
I think today many people were waiting for this session, but since we had this power issues and stuff, but I loved your determination, and we both were like, no, today we should do this. Today we must do this. We are not going to postpone anything. So I think that was the fun part.
I was worried that the rains were going to play a havoc in our conversation. But
right. No, I think today we both proved, if there is will, there is a way. Yeah. So thank you, doctor, for your time and taking out so much out of your busy clinical. I know you will be very tired at this part of the day because you work so hard over the day. And thank you so much. And just that before we end, I would just like to throw one last question. Since we talked about laser dentistry and this kind of advancement has happened in dentistry, what would be your message to aspiring dental students or aspiring dental professionals or freshers? What would be your message to them regarding taking up laser dentistry as in their clinical practice, or looking it into as well as a beneficial career opportunity in incorporating into their practice?
So yes, see, as I said, the technology and all the biomaterials that we are using in dentistry is advancing each day. So we need to keep up with these advancements. So, and laser is one such advancement, and even the units are advancing. Initially, it was only a single wavelength unit. Now we have double, triple wavelength units also.
Right.
And apart from intraoral, there are extraoral applications as well. So understanding or getting into the arena of lasers is in fact very beneficial to you. But if you do have doubts and you want to know how do I go about it or what will it do for me, you can follow my sessions also, wherein you will have
Yes.
an idea of what lasers might do to your practice or how you can get into it. And then you can make a decision of further exploring the laser dentistry specialization.
Exactly. Exactly. Thank you, doctor. It was wonderful talking to you, and I hope we'll keep meeting again and again. And thank you so much for your time. And thank you, everybody who joined in the live, in spite of that we got late. But then this video will be here, so please do watch it. It will be very beneficial if you are looking to take up lasers, or you are doing you want to place yourself just a little bit out of the crowd, and you want to give your clinical practice at different age, as well as Dr. Swarna Prabha is available on different social media handles, and we will also put all those in this description of this video once this is over, so you can always contact her and get her guidance. And well, we are looking forward to the courses, and that too online. I mean, that's fascinating. Online laser dentistry. I mean, who could have thought? So technology has brought up here. So that's all. Good night and take care, and watch this video till the end, and do subscribe my channel, and I'll bring more interesting conversations. Thank you. Bye-bye, doctor. Good night. Thank you so much.
Thank